Steve McShane, City Councilman in Salinas, and this is our first responders facing COVID-19 Zoom call. And the purpose of this call is to reflect on those that are on the front lines, certainly those in medicine, those in nursing, also those in the fire service, law enforcement that are having to deal with this pandemic in ways the public can't appreciate. I think if we can come away from this with some conclusions as to how our region can be better prepared, that'd be a good thing. So I will be taking some notes, and there will be some takeaways that'll be shared with local policymakers and those that can be in a position to support. There's a number of panelists that have joined us today, and we'd like to begin the call by just allowing the different panelists to introduce themselves and go about of COVID-19. Some departments, some first responders have seen more action than others. Some have more experience with these sorts of challenges than others. We are live streaming through KION. We're very glad to have them as a partner. And I believe Sheriff Steve Bernal should be on the call. He was going to call in and welcome us. And there he is. He's just coming in the door. So I'm admitting him right now. Very delighted to have Sheriff Bernal join us. He is our top cop in the region, certainly managing the county jail, not to mention all of our deputies servicing a variety of needs across the county. So he's just connecting with audio right now. And I imagine by now he's become a Zoom expert like so many of us. Let's see. So here it comes. And, I do definitely want to start with the medical piece. I see that Dr. Navarro has joined us, and, she is at Salinas Valley Memorial Hospital and truly a resource there on the front lines. And maybe while the sheriff is connecting, why don't we start with Dr. Navarro? If you want to just introduce yourself, your observations from a medical standpoint, and what you're seeing at Salinas Valley Memorial. I think that would be a good way to start. There's Jared sharing the welcome. All right, thank you very much, Jared. Appreciate
You're very welcome.
That. Okay, so Dr. Navarro, I'll unmute you. There's Sheriff. One second. There's Sheriff Bernal. So I'll go ahead and we'll have him start. So thank you for joining, Sheriff. We'll go ahead and turn it over to you for just a welcome from our Chief Law Enforcement Officer for the county.
Thank you, Councilman. I was called to Steve. We used to call him Steve. Can you hear me okay?
Oh, yeah, you sound great.
Okay, good. Hey, welcome, everybody. God, tough times. I tell you, these are unprecedented is what I keep hearing, but it is tough. It's an adjustment for everybody. So thank you for being on the call. Town hall meeting. You can't have enough town hall meetings in this time just to keep everybody informed on what's going on. I'll tell you, just at the sheriff's office, we're number one, trying to keep everybody healthy in our workforce, trying to keep everybody healthy at the jail. I'm not sure if you're familiar with the Chief Justice just came down with a zero bail. Our jail population is the lowest it has been since probably the 70s, maybe even the 60s. We're down to 600. But we've released over 90, close to 100 inmates. We started out releasing our most vulnerable who are already sentenced. Have underlying health conditions and are getting close to their sentences being ended, and we released about 10 inmates then. And with this zero bail, we released another 80 to 85 inmates. So, that's good that we have our jail population down. But the one thing I fear is people that might reoffend and bring the virus back into the jail. What we're doing at the jail is we're quarantining every new booking that comes into the jail. We quarantine them for 14 days before we release them into the general population. But, you know, I'm knocking on wood right now. Our force at the Monterey County Sheriff's Office is healthy. We have very few people home that either, you know, with loved ones that are vulnerable or that might have the virus. So we're staying healthy. We're taking all the precautions. But, you know, we've gone from educating and informing to where everybody should now know what the shelter in place means, and we're doing more enforcement. And luckily in Monterey County, we haven't cited too many people. We've probably no more than 10 people have been cited that I know of. You know, very, very few over the weekend. But I think most people in Monterey County get it. They're sheltering in place. They're abiding by the rules. You know, it's important to get outside and get a little fresh air, but just don't congregate in large numbers. But, you know, I think we're still a little ways from the end of this, but, you know, hang in there, and we're going to keep doing our part, and we'll get through this, and we're going to be stronger afterwards. So thanks, Steve. Councilman.
Yeah, absolutely. Thank you very much, Sheriff. And if you're able to stick around and provide any other perspective with Q&A, great. And if not, that's understandable. But continue doing the great work you're doing, and appreciate the perspective as it relates to law enforcement in our jail. I would like to start by introducing our various panelists that are with us today on the call. And I know we have a couple of doctors on the call. I'll start with Dr. Navarro, as she is at Salinas Valley Memorial, handling emergency medicine, and just want to thank her for joining us. And maybe you could speak to your experience and what you're facing and your background a bit.
Yeah, great. Hi, I'm Misty Navarro. I'm an emergency physician at Salinas Valley. I've been there for about 11 years. My husband and I, he's also an ER physician. We both came from Stanford originally. That's where we trained. And I was asked to just give a quick overview. Are we just introducing right now?
Yeah, this is introductions, but yeah, a couple of minutes, 2-3 minutes, sure.
No, it's okay. I can wait.
No, yeah, now's a good time to,
okay.
No, go ahead, give a little more detail. Yeah, that's great.
Okay, great. So I was asked to give a quick overview of the COVID-19. Is that what you'd like me to do now? I'm sorry, Steve.
Yeah, that's fine.
Okay, great. So a lot of this has been out in the news, so I apologize if it's stuff everybody knows already, but I just thought I'd kind of give a quick overview. COVID-19 is a coronavirus that emerged last fall and has been on a march around the globe, wreaking havoc ever since. It's thought to have originated in bats and then made the transition over to people and then transmitted from person to person. It's spread by large droplets, so sneezing, coughing, rubbing your eyes or nose, and then touching other surfaces, and then those surfaces being touched by other people who are then touching their face and nose. So that's generally how it's spread, similar to the common cold or influenza. Most of the people who have the virus are contagious or develop symptoms. Most of the people who have the virus are contagious before they develop symptoms or in their first week of the illness. And the symptoms are similar to what you would see with a cold or a flu. They might have a fever, cough, sore throat, runny nose. The symptoms usually start about 5 to 6 days after exposure to the virus, but can be anywhere from 1 to 14. Anyone can become infected by the virus. It doesn't discriminate based on sex, race, or age, although certain populations are more vulnerable, such as those with chronic disease or the elderly. Fortunately, our current data doesn't show a significant increased risk for children or pregnant women. Most people, around 80%, will have mild disease or no symptoms at all. Another 15% will have severe disease, such as difficulty breathing. And another 5% will have critical disease and end up admitted or in the ICU with organ failure. Most people recover in about 2 weeks, although if you have severe disease, it may take a few weeks longer. And the treatment, for the most part, is what we call supportive care, meaning oxygen, fluids, breathing treatments, ventilator support, or antibiotics to cover a co-infection. And there's not a lot of treatment currently. Some are working on research with antiviral medications or medications that block the inflammatory process, or chloroquine, which is an anti-malarial drug. The therapies are still experimental, and in general, they're reserved for admitted or critically ill patients. So I was asked, why is this so serious? And I think the reason for that is because it's a novel coronavirus, meaning our bodies have no immunity to the disease. And when your body normally encounters a foreign invader like a virus or bacteria, they make antibodies to fight the infection. We don't have any antibodies in our system to this virus, which is why people are so susceptible to the infection. Once you have a significant portion of the population that has antibodies to the infection, usually around 80%, you develop something called herd immunity, which helps mitigate the spread of disease. That's how vaccines work, by helping your body to create antibodies. And currently we don't have a vaccine or any good treatment for the disease, which is what makes it so concerning. Most models predict, sorry, I don't want to go into too much.
Right, yeah, that's good.
So most models predict that 50 to 80% of Americans are going to contract the virus. And if that were true and we had a huge surge of these patients all at once, then the healthcare system wouldn't be able to accommodate. And that's why we've had all the social distancing measures to try to flatten our curve. And luckily here on the Central Coast, and even as far out as Fresno, we've been pretty good about that. And they think it's for a couple of different reasons. You know, California closed businesses and schools early, our social distancing measures, and perhaps our rural community have insulated us a little bit from that. So we're still waiting. Testing is still somewhat limited. And so I think that as testing becomes more widely available, we may see an increase in our numbers, and it's something to be prepared for. I can tell you that, you know, even if you have a negative test or you get tested, there's still a small possibility that the test is a false negative. So if you don't have significant symptoms, or you're relatively early in your disease process and you're not shedding a lot of virus yet, you may get a false negative. And it's just something to be aware of, because it can give a false sense of security, I think, to patients, providers, or employers who are, you know, requesting these tests to be negative before patients coming back to work, which is why we usually tell people, if you don't feel good, regardless of whether or not you have coronavirus or, you know, another virus, you should just stay home and away from people until you're feeling better. And then the last thing I want to mention, because I don't want to take up too much time, is that I feel like we've actually done such a great job of telling people to stay home that we have, our volume in the emergency department has gone down dramatically. And our concern at all of the local hospitals, because I've been in contact with a lot of the other directors, is that, you know, these patients still need care, but they're afraid to come to the emergency department because they don't want to get coronavirus. So I would just like to encourage people that if you have an emergency, you know, anything that you would have normally come to an emergency department for, that it's still safe to come to the emergency department. We're separating out patients with respiratory illnesses from other emergencies, and we're still able to care for all of those things. So that would be the last thing.
Very helpful, because I have a friend that's planning on having a baby, and she had that conversation with me this morning, and that's what I said to her. We also have with us Dr. Max Cuevas. He's the CEO of Clínica de Salud, and they run a number of clinics servicing rural, communities throughout the region. And I did invite him as president of the Monterey County Medical Society, as well as a practicing physician, with those predominantly in the fields, among other things. Dr. Cuevas, hoping you can do a bit of an introduction to your role, and what you're seeing, and we'll kind of go from there.
Okay. Thank you, Councilman, and good evening to all. One of the things that, we're dealing here at Clínica de Salud Salinas, we're taking care of approximately 68,000 people that are registered in the clinic system here throughout the Salinas Valley. About almost 70% of the patients are involved in agriculture in some form of, harvesting or cultivation or packing. It's food production. So for us, it becomes extremely critical that important work group or workforce is protected. It's been listed as part of the essential workforce that the federal and state governments are trying to protect. And here locally, we take that job seriously, and we're saying we're going to work hard with all of the different components of the industry to make sure that we're able to get the resources to take care of folks. The thing that we've noticed here is that, it's true. In the past, none of us, for example, have ever dealt with anything of this size. None of us living on this phone call have ever dealt with any epidemic. This is all brand new, and what we're facing is we're making it up as we go, looking at what science is available. So we know that epidemics place massive demands on scarce resources, and they put on even more massive stress on social and economic systems. We're seeing that. What we're also seeing, however, with COVID-19 is that lower socioeconomic groups are impacted heavily. Here in Monterey County, the Latino community, bigger numbers than other groups in the area. And so we're looking at that and wondering, what is it? And it probably has to do with these folks already being predisposed to other disease conditions that put people at risk, such as diabetes, hypertension, heart disease, kidney disease. And they're also working in precarious jobs. Let's look at farm workers and the work they're doing. Let's look at grocery store workers, because they're also involved in food, in the food industry. They're exposed to other people coming in. And obviously, the healthcare workers, we're all exposed to people coming in, possibly with this virus. So it's there, and it's incumbent upon us to look at strategies that we can implement as a community, as a society. And Dr. Navarro was alluding to suppression strategies that are being implemented to identify those individuals that are infected by this virus. And once identified, what are we doing to quarantine or isolate the cases? Once they're also identified, then what are we doing to trace their contacts? And, ultimately the big part of it is, how do you socially distance people? So when you start looking at the different jobs and different members of the ag industry, well, you got to begin looking at how do you separate by 6 feet, people that are out there working, or, people that are in the grocery store working. How do you separate them from the customer? So those are the things we have to look at. And the models that Dr. Navarro was alluding to also look at, how long do you have to do this? Well, the models are based on 5 months. So recently we had kids taken out of school. We had universities shut down, because that's probably the most important part of the social distancing. But it has to be for 5 months. And now people are talking about going back again. And some of us are saying that's way too soon. We're not even at the 5-month mark yet. And you do these suppression strategies long enough to be able to develop a vaccine and the adequate treatment that would be needed to take care of people, so that people don't get sicker and die. And the models are looking at minimal 18 months for that to happen. So in our planning, I tell folks, don't be surprised if you're asked to stay indoors for the next 5 months. We started last month, so we may have 4 months to go if we're lucky. And then after that, we have to look at another year or so before a vaccine may be made available to protect and to create that herd immunity that we're talking about, that people now are protected. So it's an interesting challenge, but I think as a community we all have to look at it and as a challenge and figure out how to make sure that nobody in our community is left behind, that everyone has access to testing, to isolation, to medical care. And so in the ag community, we're looking at farm workers who live in really tight living conditions. If you're a visa worker with the H-2 programs, you're living 6 to 8 people in a motel room. So if you're going to send somebody home, that's not a good home to send them to. We need to find alternative housing. Or if you're part of a family that lives 3 or 4 families in a house in East Salinas to be able to afford the rent, you really can't send somebody home, because the home has a lot of people that could potentially be infected. So in terms of public health, we got some interesting challenges to contend with.
Well said. That's a good introduction, and we'll come back. I know there's a few questions that have come in, and appreciate that introduction. I want to continue through some of the medical introductions to this call. In fact, one of my inspiration to pulling this call together was a conversation with this friend of mine's husband, actually, who owns a small business that's been suspended, and that's Diana Padrier. Diana, thank you for joining today. I know you've been in nursing a long time, and would be very helpful to hear sort of your perspective on the front lines as a nurse, working on the peninsula, and some of your experience going back. I know you've done nursing a long time, and you even have some background when HIV emerged. So maybe a few words you could share.
Sure. Yeah, I've been out at CHOMP for 26 years. And yes, it's a very interesting world we live in now. We have our COVID patients isolated to a specific unit. I don't work on that unit, and the amount of patients we have in-house is very low. And just like Dr. Navarro said, our census is extremely low at the time. And so we too are worried about patients that don't want to come in because they're afraid of being exposed to the COVID. But like most hospitals, we have a no visitor policy right now, and all our staff are masked. So we have kind of eliminated being exposed to other people in the hospital. There are rare occasions where we are allowing visitors to come in, but it's very limited at this point.
Yeah. Well, that's a good introduction, and we'll come back. I know we have some questions for you, and thank you for being with us. I am anxious also to open it up to another nursing professional that's again a great friend that's been at Salinas Valley, and that's Carla Spencer. You play a leadership role in nursing. You've got tremendous responsibility there, and I'd love to hear your perspective and sort of an introduction there. Can you hear me? Go ahead. Sorry. Let's see. Oh, there you go. Yep, you're good.
All right. Can you hear me? Okay.
Yep.
Hi, everyone. Like Steve said, I'm Carla Spencer. I'm the Director of Emergency Services here at Salinas Valley, and I've been here about 18 years. Been a nurse 23 years, and all in critical care and emergency. So when this first started, we activated our incident command system here at the hospital, and so I've been the acting operations chief since the inception back at the end of February. So it definitely has been a pretty trying time. However, it's been amazing to see the community come together and work together, not only with the county health department, but all the hospital's first responders. And so it's, like I said, just lots of things happening in the background. I would second everything that everybody has said. We are prepared for it. We've developed many systems in the hospital to be able to deal with potential COVID patients while having the safety of caring for the other patients. So I would
We might have cut out there, but that's okay. We can come back, and I know there'll be questions for Carla in her capacity as the operations chief as it relates to the emergencies we face. We are also joined by those in the fire service. I referenced at the beginning of the call, maybe it was before we started recording this, that we have several fire professionals here amongst us, those that have more rural responsibilities in their departments, those that have more suburban or even urban responsibilities. And so I would like to start by introducing Josh Hostetter. He's with City of Salinas. There's quite a department and a lot of men and women under the entire department and its stations. So just maybe a quick introduction and kind of an overview to the department and what's being faced.
Yeah. Good evening, everybody. I'm Josh Hostetter. I'm president of the Salinas Firefighters Association, and thanks for having us, Steve. I just wanted to speak to the pride I have in the work that the men and women of the Salinas Fire Department are doing. This has kind of come as challenge to the fire service and all of our first responder agencies, the ambulance, hospitals, and I think everybody's doing the best they can with taking on the day-to-day challenges. Policies have changed almost on a bi-daily basis. I think really when we speak to the good work that the public's doing by obeying the shelter-in-place orders, our calls for service are down by about 30 to 40%. And I think moving forward, what's really important is that it's all of our responsibility to safeguard the 911 system and our hospitals. And far be it from anybody to judge what one person's emergency is in comparison to another person's interpretation of an emergency, but it's really everybody's responsibility to make sure that when we call 911, that we have a true emergency. If somebody's experiencing the signs and symptoms of the COVID virus, get in contact with your doctor. Let him point you in a direction that can maybe get you to a testing facility. If you don't have, life-threatening respiratory distress, what's really taken a brunt in our system right now is our ambulance partners, our brothers and sisters in the ambulance, because many times they're the ones that are in the back of an ambulance with poor ventilation, and they're providing care en route to the hospital, and really not the optimum situation to be in. I think things have really evolved. When this first hit, there was a lot of angst. We're not used to fighting invisible enemies. We've got. I spoke with our EMS officer almost every day this week. We currently have enough, personal protective equipment for approximately 60 days, and I think there'll probably be some more, trickling in from the federal and state level. But that's my message I wanted to share tonight is your Salinas firefighters are still there. We're still having emergencies. There's still fires. There's still vehicle accidents. All the things that incorporate a full risk fire department. And, right now, if we can all do our part to safeguard the 911 system, protect our ambulance crews, protect our fire crews, and protect our hospital staff so that our infrastructure stays in place. That's a huge responsibility that I think really the public's taken seriously. They've done their part. I think it's important for everybody to get out, smile, wave to their neighbors, get out and walk around, get some exercise. This is a tough thing. And one thing real quick, Steve, and then I'll shut up, is I think putting it on your radar. When we plan for incidents in the fire service, you take, for instance, the Dick Bruin fire. We're battling a fire in one building, but we're preparing for what happens if it gets to the next building. And I think something that the doctor from Clínica de Salud touched on that's really important is our immigrant farm workers start to come back from Arizona. And, I happen to work out on the east side of Salinas, and it's a very densely populated area with a lot of people in single family dwellings. And I really think that as local government and resources, we've got to start looking at some options to, open up some housing options for them, because coming back, from Arizona or where it may be to our area, I think really poses a risk to see a huge influx in the coronavirus, maybe just as we're hitting our downward.
Yeah, definitely. You raised some bigger issues that I think will come up as we go through the call. We're kind of rounding out some other introductions and just quick overviews. Thank you very much, Josh. And I do want to bring up Justin as well. He heads up, men and women that are serving, our rural and suburban communities of Monterey County, whether it's East Garrison or Carmel Valley. I mean, you have some of your guys in transport as well. Would love a bit of an introduction and background in your perspectives as well. There we go.
Hey, thanks, Steve, for having me on today. So again, like you said, my name is Justin Reyes, and I'm the president of Local 2606, which is the Monterey County Regional Firefighters Association. But my role within the fire district is I'm a captain paramedic stationed down in Chular. Our fire district is, over 400 square miles, and like you indicated, right, rural and other communities like that, right? We're basically unincorporated areas between all of the major cities in Monterey County. We border Salinas, Monterey, Seaside, Marina, and we work collaboratively with all those agencies. One of the things that we do in the fire service real well is the incident command system, and the way that we treated this COVID-19 was like we were on an out-of-county assignment or a big fire within the state, right? We implemented the incident command system right away. On March 18th, we implemented that. And what we also did was implemented an incident action plan, or what's called an IAP, for an operational period of time. We've identified roles, just like Carla spoke with, what she said she was the operations chief, right? All those roles are filled within our organization, and we're using that as a baseline in case we need to implement further actions. On top of that, we've been updating our IAP on a weekly basis. We educate all the crews on everything. Right now we're working, we're following the CDC guidelines. We're following what the International Association of Firefighters are putting out. We're, using the stuff that California professional firefighters are putting out, and whatever advice or information we're getting from county health. I guess the biggest dynamic that's different than what Josh spoke of is that we are in the transport business. Over in Carmel Valley, we do run our own ambulances. So that, for us, that sets up a different dynamic on decontaminating those ambulances, making sure that, our crews are taking all the precautions that we've done. And we've done a lot of things that, normally we wouldn't do, locking down the fire stations, not letting, the public visit us. Basically, we're isolating in place. We're just like the public, right? Unless we're called for emergency, we're not leaving the fire stations. We're not even allowed to train with any other engine companies, even within our organization. So we're taking those proactive steps. But it's what we need to do to get through this crisis that we're in. And I just applaud and thank everyone that's on the call for all that they're doing for the residents of Monterey County.
Sure. Yep. Well, appreciate your comments and your introductions there, Justin. And that brings me to another firefighter that I know that's spent a lot of time and has the background, military, police, police officer, firefighter. You've worn a lot of hats over the years and serving the city of Marina. Just a word or two of some of your observations. I'd like to introduce Jack Lundgren.
Hi, good evening, everybody. I'm Jack Lundgren with the Marina Fire Department, Division Chief. Just as Josh talked about, Justin talked about with the fire service, this thing kind of came on by storm, but, as with any fire department, we're ready for any situation that comes at us. So, Marina did pretty similar as to the other fire agencies in the area, developing an incident action plan. We activated our EOC locally within Marina. We work collaboratively with CSUMB as part of a regional EOC. So we activated that right out of the gate. Currently, we're doing some of the same things the other fire departments are doing in the area, such as separating our crews. We don't allow more than 3 people to ride the engine at one time. If we have a 4-person engine company, we're putting 1 or possibly 2 people into a utility, and they'll follow behind. We moved our people from our main station downtown to our airport station and opened that up, which has presented several issues for us, but we're getting through that. We were planning on opening it up anyhow. It just came a little bit earlier than what we expected. So we have our current staff out at the Marine Airport. That gives us separation from our police officers and admin staff that are currently at the public safety building where my office is at. And so that seems to be working out okay. As far as the city's concerned, we're having a spray company come in, probably the same service that's coming in. We're spraying all of our public buildings once per week. All of our vehicles are getting sprayed. So that's helping out. Doing the same thing, just our PPEs, precautions that we're taking. You know, the ambulance service, the hospitals have been fantastic, and we have to put a shout out to the 911 communication center, because they're the front line right there. They're the first person taking that call. They're able to talk to the patient and get more information and really let the field people know, you know, if that's a call that's warranting any COVID precautions. So they've really done an outstanding job there too, and I just wanted to thank them for that. We had a meeting this morning. The rumor is that FEMA might be taking over our airport and setting up a field hospital and possibly bringing in some trailers for some possible COVID patients. Maybe somebody can speak to that later, and more information will be coming out about that. But I know they've identified a few areas in the county that that's a possibility of stuff coming up. So that's really it about for Marina right now. Thank you.
Yeah, and I think we can come back to that field hospital. That's a very interesting concept, and I was out at the Marina Airport today looking at that preparation. So I think that's very real. Going through some of the questions that have been put together, I'll go back to doctors and then we'll go into nursing. And there is definitely some interest on the management side, as you know, Carla's played a role there, and then certainly, you know, to any of the other fire professionals, any other insights you have and direction. I'll start with Dr. Navarro. You know, when it comes to the public, there's a lot of fear. You know, there was the mention of possible false positives. There's the concerns over access to testing. You know, what message would you have for the public when it comes to folks that have either been turned away because they didn't have sufficient symptoms, or there is the fear to come in and they may not have a primary physician? You know, anything you could just tailor remark wise to use of the emergency room, misuse of the emergency room in these circumstances. I think that would be a good place to elaborate.
So like I was saying earlier, you know, I know that there's a lot of fear and anxiety in the community. I will assure you that we're testing people that are high risk. So high risk healthcare workers, fire, police, you know, essential workers that are out there, you know, interacting with the public on a daily basis. The patients that are sheltering in home with their families, you know, that have mild symptoms or no symptoms, those are the patients that we're saying, you know, just not yet. We don't have the ability to test you right now, but we are testing those that need to be tested. And we're testing patients that are admitted to hospital and vulnerable populations. So, you know, as testing becomes more available, more people will be able to be tested. You know, there's a lot of research going on to test for antibodies to see who's had the disease and has recovered from the disease. You know, we think, we don't know for sure, there's a lot of unknowns still. We think that perhaps once you've recovered from the disease, that it's unlikely that you'll get it again, at least in that, you know, season. And so those may be the first people that are allowed back to normal work and normal life. So I would just ask the county and, you know, the community to be patient with us. You know, we're ramping up really quickly. Testing has loosened up dramatically in the last couple of weeks, and it's going to get easier and it's going to get better. Like I said, if you present too early in your disease process or you don't have a lot of symptoms, then a negative test is really not going to be helpful to you, because it might not truly be negative. It might just be too early to be positive. A positive test is helpful because that means you have it. But a negative test, there's still a small possibility that you may have it. So if you don't feel good, stay home. You know, wow. The migrant farm communities, you know, that's a vulnerable population. Our homeless population, you know, jails, nursing homes. And so those patients are being prioritized for testing. I would just like to assure everyone.
That's helpful to know, and thank you for elaborating on that. And that's a good transition to Dr. Cuevas. You know, some of the greatest concerns that I've received as a council member, a policymaker for the city, has been that perhaps our field workers aren't exercising social distancing, that our farm worker population is in tight quarters. the largest volume of complaints from a business perspective or social distancing perspective is coming in from our more densely populated pieces of the city, just as firefighter Hostetter said. So Dr. Cuevas, maybe you could speak to that and any advice that you'd have, and the concerns over outreach. I mean, there are language barriers, the tens of thousands of mostly farm workers that are under your care. Anything you could elaborate on there would be great.
Yeah. The part of the problem, with dealing with an epidemic is how leaders will react to it. And part of our problem, I'm not being partisan or anything like that. Part of our problem was the message that came out of Washington that this was all a hoax. Now that sends into the public's mind that, oh, don't worry about this, right? And so people in all ethnic groups and socioeconomic backgrounds, if they believe that message, then they're not going to do the social distancing. And then on top of that, there's lack of transparency by governments now on how they're dealing with it. They're not providing sufficient information to sort of allay the fears of people, because what this thing has created is fear. And once you have fear in the minds of people, all hell breaks loose. They're getting information from friends, neighbors, and it's not good sources. And so part of what we have to do is make sure that we're able to provide real information to people to tell them what it is you can do to prevent from getting infected. We talked about the whole thing of if you're coughing, if you're feeling like you've got a fever, if you're short of breath, that kind of thing, call your physician. You don't need to go to an emergency room just yet. And I think that's the message we have to get to people, is that call your physician. They can take care of you outside of the ER. And then if you progress in this disease process, you might need to go to a hospital. And so we're having to educate people to figure that out. And, my hat's off to all the firefighters and all you guys that are out there, because I think early on, the protections weren't completely put in place. So you guys were running into basically a battlefield without being told what's shooting at you. And people needed to have said, look, you need to wear PPE before you take care of somebody who's calling because they're short of breath or they're, coughing and they can't breathe, that kind of thing. So it all came later on, but I guess it's just a process that we have to recognize, what the extremes of this disease are and how we as a community then respond to it, and how our first responders, because we got to protect you guys, how that's going to happen.
Yeah, excellent. Now, let me ask you to just put a different hat on, and that's your Monterey County Medical Society hat. There's hundreds of physicians that you represent in the region. I know because I've heard you say before that there is a shortage of primary care physicians. Many people, more than half, don't have a primary care physician. How would you represent, physicians in the region, and what you've heard from your membership?
Yeah, it's a problem. So some folks were left out of, during the Affordable Care Act, most people got assigned to somebody, and some people chose not to select a physician. So some folks were left out. But in the private offices, for some reason, the planning that occurred, folks mentioned the incident command, that was all based on the response to 9/11. And somehow private offices were left out of that physician response. I guess they figured they would organize around the hospital systems, which they did. But that's only a portion or part of the healthcare system that we all live in right now. And so there are physicians out there that aren't able to take care of folks that have symptoms that might be related to coronavirus. That is, they don't have sufficient personal protective equipment. And so that's become a problem. So some of us that have some equipment, we've been donating it to some of the private offices so they can get some. I've been asking folks to figure out how we can register them to that MOHAC system so they can also get some of the supplies that are being sent out by the state. So that's a problem. So right now we're trying to figure that one out, because right now we've limited ourselves to be able to respond only as a hospital with, now hospitals hire physicians through their foundations, but that's not the entire physician community. So a big chunk has been left out.
Right. Excellent point. And I think there's a lot of lessons in this. I do want to transition back to the nursing side of things, and, back to Carla Spencer. You've got a lot of responsibility when it comes to Salinas Valley Memorial. I have heard from some of the nursing community that, folks are going a little crazy because, there was all this preparation. There isn't quite the census count that was anticipated. How are you managing that, and how would you represent your nursing staff and morale? There's a lot of people getting a little antsy out there, a little crazy, some would say. How can you speak to some of what your observations there, and how you keep the happy faces on?
You're absolutely right, Steve. We did experience that, the kind of a dramatic drop in volume and patients, and not only in the hospitals but in the clinics. And so I think right now and early on is that we want to plan for the worst and hope for the best, right? And we want our staff, we want our patients to know that we're ready and we're prepared to deal with COVID-19 and whether we get a surge or not. And we continue to plan. We continue to plan for the surges because, like a couple of you have talked about, there are a large number of people coming back to the community, and we still need to talk and we need to be prepared because we don't know if that surge is going to come. So at this point, in terms of the nursing staff, is I think we're utilizing our nurses in other roles. We have built a labor pool at our hospital, and we're doing things like sending nurses. We had a group of nurses, one of our directors, go out to Dole yesterday, and they spent the day educating our farm workers, the workers that operate the sprinklers. And so, the hospital's committed to keeping our nurses working. It is a pretty scary time. We've seen volumes in the ER we haven't seen in 20 years. So I think, and I'm sorry I got cut off before, but, just like Dr. Navarro said, it's concerning to us because we want to make sure that people are getting the care that they need. And what we're seeing is that, when people come into the emergency department, they're really sick. So they've been kind of waiting at home, and, and then by the time they get there, they're really sick. And so, we just kind of weather that storm. Again, utilizing our nurses to do other things. We went to universal masking in the hospital where everybody is masking. So we have a nurse that sits up in, at 3 different entrances of the hospital, and they're handing staff masks every morning, every evening, at night, that kind of thing. Early on, the hospital here built a hotline so that patients can call, doctors' offices can call, and so we're utilizing our nursing staff doing, working the hotline, being able to answer some of those calls. So, I think right now we're doing pretty good. We're giving some people some time off, we're kind of, so that's nice. We just went through a pretty horrific flu season where we saw very high volumes, very sick people. So it's actually a nice little break for some of our nurses to get some paid time off so that they could take some time off. And again, we don't want to say we're out of the woods. We see numbers and things like that. And while we're optimistic, we do have a big vulnerability here, and that is our field worker population and the population density that exists in those areas. So, we'll just keep planning. We're surge planning. We're looking at ventilators. We're looking at places in the hospital, alternate care areas, all of that kind of stuff. So.
Wow. Well represented and well prepared helps. I'll transition to Nurse Diana and her nearly 3 decades of experience. I do want to focus on, as I know we chatted a little bit about, Diana, your experience having early encounter with HIV. It's amazing how the fear, I did an interview on Monday with a COVID victim, and some of the comments as the interview propagated through social media, some of them were downright hostile towards, how much more of a quarantine there should be. And, I know somebody that's a bit older than I am that was in nursing and actually left nursing because of the uncertainty and the unknown in HIV, was actually, fearful at that point in their career and went into teaching. So maybe you could speak to just the fear and anything you could say to the public about being fearful and overcoming that. That might be really helpful.
Yes, actually, when I first got hired, I worked on an HIV floor. And so I learned to start my IVs on HIV patients, and we just learned to be very careful. And I cannot emphasize how important it is to wash your hands and do it for 20 seconds. Soap and water is your best defense. And I think another important item to emphasize with the public is we encourage people to wear masks and to wear gloves, but we didn't exactly train them or teach people how to put a mask on correctly and how to take off gloves correctly. And I think that's an important thing for the public to understand, that when you put on a mask, you don't want to touch your mask. You want to take it off on the elastic. You don't want to touch any of the inside, because that's what's protecting you. And as far as your gloves, I know there was some discussion about you shouldn't even wear gloves out there because you're touching one thing and then you're touching another. And I see people driving in their cars with their mask and their gloves. And really, you really don't need to do that. You have to, I consider when you wear gloves, consider it covered in mud, and everything that you touch is going to have mud on it. So you don't want to you want to dispose of your gloves and mask. And I think one of the things I also see out there is people just throwing their gloves and their masks in their carts or on the parking lots. And we need to be responsible. We need to protect ourselves, and we need to protect others and clean up after ourselves. That's also very important. As far as being in the hospital, we do all wear masks, and I am also part of the HICS organization that we have at my hospital. So I'm there, I hear about all the cases and what we're doing, and we are very proactive at this point. And we are well prepared for a surge. And I've talked to the nurses that work on the unit where they're taking care of these, and including my nurses, and they want to take care of these patients. They want these patients to get better, and they do get better. And I don't think we hear a lot of that these patients do get better. And so I think that's important. The nurses are taking care of their patients, they're taking care of themselves. And yes, there's fear, there's always fear in the unknown, but we have taught them well. Our organization has had PAPR training. They're constantly, our infection prevention nurses and doctors are constantly going around to make sure everybody is donning and doffing their PPE appropriately. So we have gotten a lot of support through CHOMP.
Very helpful, and thank you. And that's where I want to transition to one of our panelists that I know. He's a division chief by day, but he's also someone that also oftentimes is called on for counsel. Younger firefighters under pressure that may not be as familiar with a schedule as grueling and as always on. Jack, maybe you could speak to how you would counsel members of emergency medicine, but also those in the fire service that are experiencing fear or trauma, whether it be the concerns of even going home to their family and a spouse or a partner that's on edge because they've been out in the public. I mean, how are you counseling, and what advice do you have to those on the front lines, but to those family members impacted? I know you wear your faith on your shoulder, and you've always been that rock. You've seen a lot, maybe any advice you'd have? There we go.
I think you got me now. So thanks, Steve. Yeah, it's a really good question. And, like a lot of the other panelists talked about tonight, this thing kind of came out of nowhere. And so I have been getting, early on, a lot of my firefighters came to me and they said, we've never dealt with this before. I mean, we see cases and cases of flu, or we see infectious diseases, but they're short-lived. And, we all know how to deal with them, from the frontline firefighter to the person that works in the ambulance to the medical professionals at the hospital. This thing just seems to take a life of its own, and just it goes like, to coin the phrase, wildfire. So a lot of my personnel have asked, well, can I go home? Do I need to take 4 showers a day? Do I have to be separate from my crews? And a lot of them were worried really about going home to their spouses, to their children. You can walk by somebody who has it, who is asymptomatic at the time, and you collect it, and now you're dragging it around. So, and I think most of the organizations, I mean, I'm going to put it out there, and I think, but everybody should agree, but I think we've developed policies within that incident action plan that we're giving firefighters options if they don't want to go home. We've secured hotels here in Marina. If they want to be in a hotel, we'll let them stay at the main station if they feel that they don't want to leave. I mean, if they start to feel symptomatic, we'll make arrangements for them, in some way or another to take care of them. And it really is kind of a new path that we're venturing down. And, I probably don't have the greatest answer. I think it's just listening to them. I think listening's the biggest thing, and trying to answer their questions as best as we can. We're all kind of learning this disease and, how it progresses. And, we have to listen to the experts. We have to listen to the medical professionals, and take that back to the troops. We talked about I sat in 2 other Zoom meetings just today in regards to this COVID. And again, I talked to the person who's spraying our city, we're just trying to take the steps to relax that fear. Obviously, everybody's going to be fearful. Everybody's got questions. And so I think for my organization, it's really that listening and just doing the right thing for the person. And our city's been really great. The council's been fantastic in that they said, whatever needs to be done for our personnel, we're going to do it. It doesn't matter what it takes. The resources are the people here. And I imagine that, the other organizations that are represented here are probably, kind of along the same lines. And so that's really been helping a lot, especially with our organization. And, it'll continue. And that's just been really great. So myself and my chief, we're just, like I said, we're listening right now, and we're doing what needs to be done to take care of our people right now.
Sure. Thank you. And I think Justin's still on here. I wanted to go back to Justin for just a second. And there was a good point here in the chat as to people wearing gloves, but then still digging through their pockets and touching their phones. And, I really appreciated that. That was a good point there. Thank you in the chat. Justin, I know you play a big role, as does Josh, in IAFF. Can you speak to the region and coordination amongst fire service agencies and or what you've heard statewide as to concerns where firefighters are really some of the greatest risk is this, this pandemic strike. So some of your observations, both at the region and then at the state level. There we go. There we go.
All right. Yeah, Steve. So the IFF was, they were fast out on getting information, right? It was web-based. There's email communications. I've even gotten phone calls as the president for our local from the IFF back in Washington, making sure, right? They have a tracking site up on their website to track all the memberships within the United States and I believe Canada as well. And we go in there and input, and then the IFF can follow the trends of exposures to firefighters and things like that to the COVID-19. Last Friday, I was on a conference call similar to this one with the California Professional Firefighters. President Rice gave us an update of what they're doing at the state level, ensuring us that if we have any issues or we have any needs, that we can go ahead and contact the CPF, making sure that we know that we can go through the county OES and the state OES to get supplies such as N95 mask, the P100 mask, all the stuff that the state has surplus on there. One of the biggest things that they brought up in the CPF meeting was, I think about 3 years ago, there's a bill, State Bill 432, which was adopted by the state of California, which basically entitles first responders to get access to information. And specifically, the information is if we transport a patient with a communicable disease, we need to leave the hospital with the information of the responders that were on that incident. And the hospital's staff will contact, a representative within our organization to let us know testing results, right? Well, the communicable disease that we're dealing right now is with COVID-19. And that's one of the things that, we're striving to do. We've had a couple of our responders go on calls where patients have come back. There's a little bit of lag time in between us being notified right now, but I think that's because the testing hasn't totally ramped up yet and the communication networks and everything else. We've gotten the information back, but it's just one of the things that, you can imagine if one of our guys gets exposed or thinks he got exposed and now he's waiting in quarantine, that's nerve-wracking in a sense. But one thing that our organization's done is that we've set up a quarantine spot at one of our fire stations where we've actually brought in travel trailers and things like that. So the employee has the opportunity to quarantine away from his family and is going to be logistically supported by the organization.
Great.
And then on the local level, and Josh can attest to this, and I'm sure Jack knows as well, basically all the locals in Monterey County, CAL FIRE, Seaside, Monterey, Marina, North County, Greenfield, Salinas, Seaside, and Monterey County Regional, we have a working group that basically has a conference call every week. So all the locals are in a constant communication with each other, sharing information, sharing different things that we're doing, right? Just basically coordinating efforts. I mean, I've never seen all the firefighters in Monterey County work collaboratively together, but I think when you go to Josh, he can attest to this. This is like one of the big things that I think is going to come out of this is that we can all work together. We have a common goal, and we're communicating with each other. Although one last thing I want to mention, Steve, is that this week is National Dispatchers Week. County Comm plays a big role in the response to COVID-19 right now. County Communications has been directed to answer or ask specific questions to all calls that come into EMS dispatch. So they're basically trying to pre-screen medical emergencies before we arrive on scene. They have a series of questions that they ask, and then that they basically advise the crews as we're responding what type of precautions we should take, right? So the blanket term is if there's any suspicion or a high index of suspicion that they could have a respiratory issue, basically they tell us to take respiratory precautions. So it starts from the 911 call to us arriving on scene, to transporting the hospital, and obviously, right, we're going to communicate that information to our base hospitals when we're transporting our patients in.
Yeah, really, really helpful. Thank you. And we'll round it out with Josh. One of the things that's come up, Josh, is how can we help? And obviously there's the nursing and the medical, but you could speak to members of the public that want to bring cookies or donate, or in what ways can the public be supportive? In anything you could add there, or maybe even to add to Jack and certainly Justin's commentary.
Yeah. Am I on? You hear me
Yeah.
okay? All right. As much as I'd love a plate of cookies right now, we'll go ahead and save them for another time. All of our firehouses are closed. So if you come to the door, we'll open it and talk to you, but we're going to social distance. And that's really the challenge here is protecting our crews. If the public could do anything, it's do your part, follow the shelter in place orders. And, right now, currently across the nation, there's 6,000 firefighters in quarantine. And, as this gets, however big it's going to get, we don't know. We have limited services in Salinas, right? I've been there almost 2 decades. We have the same amount of firefighters on duty today as we had 20 years ago. And yet our call volume has almost tripled. So we have across the county, in all of our cities, a very sparse 911 system. So we really, as a community, have to take the measures to protect those first responders. If you do call 911, and the dispatchers have been doing a phenomenal job. Yesterday was National Dispatcher Day. They've had to really take extra measures to protect our first responders before we even get there. Our tactics have completely changed to, currently we're sending kind of one medic at the tip of the spear to go in and assess the situation. But if you do happen to call 911 and you can walk out and meet us in the front yard, if your emergency allows for that, that's going to be big. That gets us out into the fresh air. But this is a really, really challenging time. And I think when firefighters wake up every day to go to work, they know they're going to battle. But right now, this is every day a serious battle. And I think great leadership is going to rise to the top. And I think that the lack of leadership is going to be under a microscope. Yeah. And I think, I appreciate you having us on here, Steve, and your leadership is invaluable. I don't know how you do all the things that you do for the community, but be good to each other, hug your families, and take care. If you haven't cried yet, have a good cry.
Well, thank you, Josh. And just to sort of round things out, I want to again recognize KION. They are doing a live stream. I also want to point out Max Fit Meals. They've done a lot for our first responders, not just via social media, but they've, walked the walk with meal delivery and support. They helped to sponsor tonight's call, which was great by doing some ads and getting the word out, which I think is great. Just repeating a few things. I really appreciated what was said by the sheriff as to our jail being in good shape, the concern over some of the releases that were actually mandated through the state justice system, being mindful of that. But I also appreciated the importance placed on our hospitals, our ER. They're open. So don't need to have that baby at home. There's tremendous effort that's gone into making sure that COVID-19 doesn't endanger all medical care. The importance of self-care and paying attention to what is a reason to go to a hospital or maybe not. The importance placed on washing your hands. Great reminder there, Diana. And keeping those cookies away from the firehouse right now. I get that. And, at the end of the day, a lot of policy takeaways. I think Dr. Cuevas's point to, those primary care physicians that may not be associated with a primary hospital or may have been maybe not as connected through some of the response to Obamacare and such. You know, in the end, COVID-19's here, and it might be 5 months and ultimately a year or more before that herd immunity comes. So at the onset here, we've been shocked. The economy has been brought to its knees, and we will have to reintegrate. I know there's a lot of planning at the county and at the state level for that, and certainly as a city councilman and at the city of Salinas level, very sensitive to that. You know, relieving and aiding business and making sure that our residents are safe. So I think the message underscored amongst our firefighters that attended today and amongst everyone is working together, and how that's the most important takeaway. So I will share some notes in a follow-up to those that attended. We will create a bit of a summary video, and just want to acknowledge our first responders, those in emergency medicine, our nursing staff, our law enforcement professionals, and certainly our firefighters. So with that, just want to say thank you to everybody that attended. We're ending just about on time here, which is great. And, you know, again, look forward to continuing to work together through this. So we'll go ahead and end it there. And again, thank you for being a part of this call today.
Thank you, Steve.